Good afternoon. My name is Richard Isaacson. I'm an Alzheimer's specialist at New York-Presbyterian, Weill Cornell Medical Center in New York City. Today we'll be talking about the topic of Alzheimer's prevention. We're really excited to have you all here online, and if you want to ask any questions, please type it into the box live here on Periscope, and we'll also be answering questions that have been submitted through Facebook, through Twitter, and through other sources. Again, my name is Richard. I am an Alzheimer's specialist, but when it comes to Alzheimer's disease, Alzheimer's is also personal. I've had 4 family members diagnosed with Alzheimer's through a variety of different ages and stages in my life, and today I'll hope to answer the pressing questions that you have. I know when I was in medical school, I really wanted to learn about Alzheimer's for obvious reasons, and over the last 15-20 years, that's what I've been focused on. So I guess we can get started. Okay, so the first question, we'll start with a general overview question. What is Alzheimer's disease, and what are the symptoms and risk factors? So this is a good place to start because our understanding of the definition of Alzheimer's disease is quite different today than it was even several years ago and especially decades ago. When I was in medical school, people used to say, well, dementia is common, Alzheimer's is common, everyone will end up getting dementia or Alzheimer's disease. And now we know that that's not the case. When it comes to Alzheimer's disease, it is the most common form of neurodegenerative dementias, or a brain disease that causes memory and cognitive impairment. Alzheimer's disease is a slowly progressive problem. It's very common. At the age of 85, over 40% of people age 85 and over have Alzheimer's. That being said, Alzheimer's is not invariable. It's not something that everyone will get, but it's something that we now know today also starts 20 to 30 years in the brain before symptoms start. So Alzheimer's is a disease that develops over decades and then continues over at least a decade. When it comes to some of the symptoms of Alzheimer's, memory loss is the most common, but as most of us may have experienced, especially those with family members with Alzheimer's, it's not just memory loss that's the problem. Sometimes there's behavioral changes, depression, anxiety, agitation, and even problems with sleep. When it comes to risk factors, there's a variety of risk factors. Age is actually the #1 risk factor when it comes to Alzheimer's disease. Genetics is also one of the possible things that can increase a person's risk. However, when it comes to genetics are confusing because genes are not your destiny. Certain people with certain genes can actually take control of their brain health and try to win the tug of war against their genes, and that way to try to reduce their risk based on their genes. However, other people have genes, and unfortunately they will get Alzheimer's no matter if they do everything right, and that's why it's a pretty complicated situation. So let's go on to the next question. The next question is, how do you diagnose Alzheimer's disease? So Alzheimer's is what doctors call, for the most part, something called a clinical diagnosis. So a clinical diagnosis means a doctor will meet the patient, will talk to the patient, will talk of course also to the patient's family, which is really important, and try to, based on the history that the patient and family says, make a diagnosis based on the history. That's really one of the key components. However, now in 2015, we can do a variety of really sophisticated tests that weren't available a long time ago. So as an example, oftentimes when someone comes in with a complaint or a problem of memory loss, the doctor will order a variety of tests. So one of those tests could be a blood test looking for medical causes of problems with memory loss. Sometimes your thyroid is checked, vitamin levels are checked, and then also a doctor will most routinely order an X-ray of the brain, or something called a neuroimaging study. A brain CAT scan or a brain MRI. The MRI is usually a little bit more commonly ordered because what the doctor is going to try to do is make sure that nothing funny is going on in the blood or nothing funny is going on in the brain. That being said, sometimes blood tests and MRIs and CAT scans don't tell the full story, so doctors rely on their clinical judgment to make a diagnosis. Now, however, there are some very sophisticated tests that are available today. Over in the last few years or so, there's now much more specific tests. So if someone really wants to know if they have Alzheimer's disease and they want more information, the doctor can order a test called an amyloid PET scan. Now, what does all that mean? Amyloid is a word. It's a protein, a bad protein that gets clogged up in the brain. And there's actually something called a PET scan. A PET scan is not exactly like an MRI or a CAT scan, but it's a different way of looking at the brain, and you can actually look for amyloid in the brain. There's a variety of other ways to diagnose Alzheimer's disease also. These tests aren't used that commonly. They're used oftentimes in research purposes, but in the clinic, you can also do something called a spinal tap or a lumbar puncture, where they get fluid and they look at the fluid that's usually surrounding the brain, and they can actually use that to better diagnose Alzheimer's disease. Okay, next question. I have a family history of Alzheimer's. Is the disease hereditary? So that's a really, really common question. What we can say is, like we talked about before, genes are not your destiny. There are people that are walking around that have genetics or genes that may suggest that you have a higher risk of Alzheimer's, but those people will not necessarily get Alzheimer's. And there's a variety of different types of genes. This is complicated, but I'll try to keep it simple. First, there's two different types of Alzheimer's disease. One that's called early onset Alzheimer's disease, usually before the age of 60. And the other type is called late onset Alzheimer's disease, which is by far and away the much more common form of Alzheimer's. For those people that have a family history of Alzheimer's where their disease starts in the 50s or earlier, and several family members have it, that's only 6% of all types of Alzheimer's. Those people may have an early onset Alzheimer's gene. Now, these are very rare, but these types of genes are much more harder to fight. Those genes basically mean that if you have a family history and these genes are in the family, up to 50% of the people in that family could potentially get Alzheimer's disease. Again, this is a very, very small minority. There's another type of Alzheimer's called late onset Alzheimer's, and late onset Alzheimer's disease may be associated with a gene or maybe not. And we now know in 2015, especially with some of the more recent studies, that if you have this one gene you may have heard about called the ApoE4 gene, if you have the E4 gene, your risk is a little bit higher, but you can do very specific things like lifestyle changes that can actually neutralize the negative effect of that gene. So I think it's really important to realize that regardless if someone has a family history or not, or regardless if someone knows their genetics or not, there are a variety of things that people may be able to do to reduce their risk. Okay, next question. What is the difference between Alzheimer's disease and typical forgetfulness? So Alzheimer's is the most common form of memory loss in people over the age of 65. Common things happen commonly. So roughly 60-70% of all people that develop something called the dementia, we'll talk about that in a second, 60 to 70% of all dementias are actually caused by Alzheimer's disease. Now, there are several other causes of dementia. Well, what is dementia? Dementia is a problem with memory that leads to a problem with that person's ability to take care of themselves. So there's lots of different forms of dementia, but Alzheimer's is the most common. There is lots of different other forms called, one is called vascular dementia. This means your arteries and your veins, they aren't working well, and you may have, just like someone has heart disease, you can also have brain disease of the blood vessels in the brain. So you can have vascular dementia. There's other causes. One is called dementia with Lewy body, which is very similar to something called Parkinson's disease, but also has dementia. Another type of dementia is called frontotemporal dementia. That's a dementia that starts if you're less than 70 years old and is really characterized by lots of funny behaviors. Now, these are all dementias. Now, dementia is very different than typical memory loss, and people can have memory loss or be forgetful, but that doesn't mean that they necessarily have a dementia. As we age, there's several things that happen which can be expected as we age. So it may take longer for a person to remember something, but the person remembers it later. That word or that phrase or that person's name may be on the tip of your tongue, but it comes back to you. So when something's on the tip of your tongue, or when something takes longer to remember, or the processing speed or the thinking processes are slowed, that may actually, people may think that's memory problems, but actually it's different. It's actually a problem with attention. So these things aren't necessarily in the category of memory loss. They're forgetfulness due to problems with attention that are associated with age. So that's one quick summary, but there's a lot more to it, and I'll give you some information at the end of this session for more information on this. Okay, this next question is from Jody. And the question is, I've heard people describe feeling fuzzy in their head or reaching for simple words or memories. Is that normal? So feeling fuzzy can be, how do we put it? One person can say I'm feeling fuzzy, and another person can say I'm feeling fuzzy, and all the different people can say the same thing, but it mean different things. So usually when a person says that they're feeling fuzzy, that usually could imply that they may be feeling lightheaded, or they may be feeling slow, or their memory or their thinking processes may not be working as well as they could. And what a doctor needs to do is needs to figure out exactly why that brain is feeling fuzzy. So as an example, when an older person with a little bit of memory loss gets an infection, like a urinary tract infection or the flu or something else, any type of medical illness like an infection can actually increase the fuzzy feelings of the head. People that have lung problems, people that have pneumonia, for example, their oxygen levels aren't absorbing as much, and that can cause a person to feel funny. Also, blood flow problems can also cause a person to be funny, feeling funny in the head or fuzzy. So anytime a person feels fuzzy, we always make a recommendation to see at least the primary care physician and be evaluated, because instead of just jumping directly to a brain problem, we oftentimes want to make sure a medical problem is not happening. When someone does feel fuzzy, it could mean a whole variety of things, and most commonly, if you're having fuzziness in the head, that may not be a memory problem, but it may be more of a problem with focusing. When someone can't focus on something, they're not paying attention. When someone's not paying attention, they can't remember. So it's kind of a downstream effect of an attention problem. Next question. When should people start thinking about prevention? So this is a really new concept in the field of Alzheimer's disease. And actually in July 2013, the first ever Alzheimer's prevention clinic was actually founded right here at New York-Presbyterian, Weill, Cornell Medical Center. And the concept of Alzheimer's prevention is brand new, basically, because in the past we really didn't understand that Alzheimer's disease starts in the brain 20 to 30 years before the first symptom of memory loss. So as an example, when my Uncle Bob was diagnosed with Alzheimer's disease, he was having memory loss, and the memory loss was progressing, and the memory loss was progressing so much that he couldn't take care of himself. And when I was in medical school, we were taught that, well, that means that he got Alzheimer's disease right around that time, maybe a few years earlier. What we now know is Alzheimer's disease starts in the brain decades before that very first symptom of memory loss. So when should a person start thinking about memory loss? Well, today, yesterday, as soon as possible. We have patients in the clinic, most commonly in their 30s, 40s, 50s, 60s, 70s, and beyond. And you don't usually think of someone in their 30s or 40s coming to see someone in an Alzheimer's prevention clinic, but that's exactly a good place to start. That being said, people in their 50s, 60s, 70s, and even 80s should also be thinking about Alzheimer's prevention. Whether you see a doctor and talk about this, there are now several Alzheimer's prevention clinics throughout the country, or whether you think about joining a clinical trial. And hopefully we can talk about this more later, but if, for example, if you're between the ages of 65 and 85 years old and interested in a clinical trial, there's trials out there that you can actually join. And at the end of this broadcast, we'll give you a link to a free online course that anyone can take to learn not just about Alzheimer's disease, but also about these clinical trials. Okay, next question. Are there habits that accelerate Alzheimer's? If so, what? So this is a great question, and what we now understand is that there are several risk factors for Alzheimer's disease. So what is a risk factor? A risk factor is anything that a person does in their life or is given in their life. So for example, genetics are a risk factor that you can't change. Age is also a risk factor that we right now can't change. But when it comes to certain risk factors, these are called modifiable risk factors. A modifiable risk factor is something that we can change that may reduce a person's risk for Alzheimer's or may delay its onset. And that's really a key distinction. So what are some of these things? Someone that doesn't exercise, well, that person is at an increased risk of Alzheimer's disease. If a person exercises on a regular basis, and that's mixing up cardiovascular exercise as long as you also include weight training, resistance training, building muscle strengthening exercises is absolutely essential, and clearing this with the treating physician before starting any Alzheimer's, exercise program. Exercise is a modifiable risk factor that can actually bust up that amyloid, the bad stuff that accumulates in the brain, and delay onset or even potentially reduce risk. There's a variety of other things that people can do to reduce their risk, making very specific brain healthy dietary and nutritional choices. We now know that you are what you eat when it comes to brain health. That being said, you can't just eat one specific food or have some blueberries once in a while and think that that's going to prevent Alzheimer's. I wish it was that simple, but it's not. But there are very specific dietary choices that people can make to reduce their risk. There's a variety of other things, protecting your head, avoiding head trauma, there's multiple other things, keeping engaged in life in terms of cognitive activities. Someone that has many years of schooling, for example, it may be protected a little bit. If you haven't had many years of schooling, that's okay too. Taking adult education classes, learning a new language, learning how to play a musical instrument, even midlife and onward. There's research that shows, as one example, that playing a musical instrument, even from midlife onward, can actually delay cognitive decline. These are just one of the many things that are risk factors. Okay, next one is from Ital Vegan. Okay, the question is it true that a plant-based diet can reduce the risk of Alzheimer's? So I would say that overall, I would say my general answer is probably yes. A plant-based diet is among the probably best brain healthy types of diets. Yet, dietary choices are very confusing. First of all, there's no, in my opinion, one-size-fits-all approach when it comes to dietary choices. So Mr. Smith, based on his genetics, may need to eat foods A, B, and C. But Mrs. Jones, based on her genetics or her family history or her body makeup or metabolism, may need to more focus on X, Y, and Z. So I want to be clear that we don't have all the information yet, and this is a little bit complicated. But I would say overall, a plant-based diet is among the brain healthiest ways to eat. That being said, some of these details are a little confusing. When it comes to the research, the type of diet that has had actually the most evidence or the most benefit for protecting against Alzheimer's disease is the diet called the Mediterranean style diet. Mediterranean diet is really along those lines. It's a very plant-based diet, brain healthy fats, for example, from olive oil, a tablespoon a day, eating plant-based foods, whole grains in moderation, wine, one drink a day in women and 1 to 2 drinks a day in men. And red meat and other meats in moderation as well, lean meats especially. So the Mediterranean-style diet probably has the most evidence. There's other diets out there. A study called the MIND diet was released not that long ago. That is a similar concepts to this, but a little bit different. The study that we're doing now here at New-York-Presbyterian, Weill, Cornell, is kind of a modified version of these diets. So I guess my gestalt here and my overall statement is plant-based is great, but certain people may be able to eat a little bit out of that realm, and other people may need to eat more closely to that in order for their own specific brain health. And again, at the end of this session, we'll be giving you a link to a free course about Alzheimer's disease that focuses very heavily on brain healthy nutrition and dietary choices. So that goes into more detail than my answer. Next question, are there habits that accelerate Alzheimer's, and if so, what? Yes, I would say there are multiple habits, kind of living a not healthy life. Anyone that has diabetes and doesn't pay very close attention to their blood sugar, someone that has high blood pressure, high cholesterol, and isn't under the care of a physician and making those brain healthy and heart healthy lifestyle and dietary choices, all of these things can absolutely put the foot on the gas when it comes to accelerating a person's onset or increasing a person's risk for Alzheimer's disease. Eating of unhealthy types of diets, not exercising on a regular basis, not sleeping well on a regular basis, all of these things, especially in combination, can increase risk. Another really big risk factor, and this is not something I had focused on in the past 10 or 15 years, but much more recently because the research is now coming along, and that's stress. Stress is something that absolutely ages the brain. As one example, every 4.5 years of work stress adds 1 extra year of brain aging in terms of cognitive decline. So what we try to do is we take a comprehensive approach, and we think of seeing a doctor on a regular basis, potentially a nutritionist too for dietary advice. If you have high blood pressure, high cholesterol, diabetes, making sure these are really in check, watching what you eat and exercising on a regular basis. But I wish it was as simple, and it's much more complicated. Taking a very targeted approach at all of a person's very specific risk factors and intervening one by one is the best chances that we have to reduce risk in protecting the brain. Okay, next question. What are three things that people can do now to prevent Alzheimer's disease? So 3. Wow. The good news here is that I could probably list a dozen. Probably list 2 dozen. And if we would have been having this session, 20 years ago, we wouldn't have had things like Periscope, we wouldn't have had Twitter, we wouldn't have had Facebook, and we wouldn't have had 20 things to discuss about Alzheimer's prevention. So that's the good news. If it comes to 3, I would say number 1, get educated and get informed. Too many people think that there is absolutely nothing a person can do to reduce their risk, and I just don't agree with that. Based on the most recent evidence, 1 out of every 3 cases of Alzheimer's disease may be preventable based on these modifiable risk factors that we talked about. Again, the problem here is that 2 out of every 3 cases of Alzheimer's is not really preventable, and that's why we're waiting for the next big blockbuster drug to come, and hopefully a cure is on the horizon. I don't know when a cure will come. I'm not really sure. It's going to take a while. We still have a long ways to go. But when it comes to prevention, I would say we're making lots of progress. Whether it's 10 years from now, 12 years from now, or even less, we're making progress. So number 1, getting educated, getting informed, not being fearful. Knowing that you can take control of your brain health, watching sessions like this, and learning as much as you can. And again, we'll give you a link to a free course you can take that's fully evidence-based and reviewed by experts. The next 2 things, if I only have to stick to 2, is it has to be exercise. Exercise on a regular basis is absolutely essential, and it's not just going and running the New York City Marathon. That's not going to cure or prevent Alzheimer's. It doesn't work that way. Cardiovascular plus weight training, watching your waist size, losing weight if you need to, gaining muscle mass. There's very specific types of exercise that probably work best. And finally, nutrition. Nutrition is absolutely one of the most key things, and realizing that you need to eat different things based on your medical problems. So if you have high blood pressure, you may need to eat one way. If you have diabetes, you may need to eat another way. But what we try to do is eat as healthy as possible, both for your brain and your body. Okay, next question. How does the Alzheimer's Prevention Clinic work? What tests and treatments are offered, and what is a typical appointment like? So the field of Alzheimer's prevention is still in its infancy. We were the first clinic that got started 2.5 years ago. Time flies. Now there are at least 2 or 3 other clinics throughout the United States, one in Birmingham, Alabama, one over in LA. So the field is in its infancy, but it's slowly and steadily increasing. What is an appointment like? An appointment is longer than some people would expect. Before a person is even seen in the clinic, what we need to do is we need to have the person fill out very comprehensive surveys and evaluations, filling out a 45-minute survey online after the appointment is made. We then send people to our educational website, and we ask all of our patients to not only take a course online in divided lessons, 5 lessons that are each anywhere between 5 and 12 minutes or so. We also have people in the practice take cognitive testing online, so they can actually take around 20 minutes of cognitive evaluation online. So after all that, they then come into the clinic. They spend about 45 minutes doing computer-based cognitive testing, more like games. They do about 20 minutes of testing on paper, and then even they do some card game tests too. We then do a variety of measurements. We do weight and body fat and waist circumference and all those sorts of things. And then the person spends at least an hour of direct clinical time with the physician. And this is not something that can be done quickly. This is something that literally takes hours and hours to do. After that's done, we basically send the person for a fasting blood draw. In the blood draw, we look for a variety of things, looking at different things called biomarkers or markers of disease. So, for example, we'll look at cholesterol levels, we'll look at nutritional markers, we'll look at inflammatory markers. We'll look at a whole variety of things to help us make better targeted choices and personalized choices. One of these things is genetics, and what we do is if a person consents, we can look at certain genetics and make very specific targeted approaches. This is a field called personalized medicine, where if one person has one gene, I'll make one set of recommendations, or another person has another gene, we'll focus recommendations differently. So we look at genetics, we look at the blood, and then aside from all that, we then have to have a conference. So basically, we have a team of 17 different people. These are people from not only all over the country, but all over the world. We had a collaborator here from Australia last week. We have collaborators in Puerto Rico and Europe, all throughout the United States. And then every single patient, actually, we have a conference about. So for 20 minutes, we then discuss every single patient that comes through the clinic with nutritional experts, neuropsychologists, preventative cardiologists. We actually have 3 preventative cardiologists on our team, endocrinologists, neurogeneticists. Yeah, it's the brain trust. Since we just don't have the textbook written yet on Alzheimer's prevention, we literally use 17 experts from all around the world to discuss every case. Then the person comes back a couple of months later. We discuss the lab results with the patient, and then personalize or target the approach a little bit better. And then every 6 months, the person will have a repeat of cognitive testing as well as blood work to basically allow us to understand, are the recommendations that we're giving, are those working? Is cognition stabilizing or improving, or are blood markers and risk factors going away? Next question. What is the future for Alzheimer's prevention and finding a cure for Alzheimer's? So we have made tremendous progress in the fight against Alzheimer's disease. That being said, there still is a long way to go. If someone would have been telling me 10 years ago that I'd be here talking in front of all of you and using the words Alzheimer's and prevention in the same sentence, I would have said, I don't know if we're really there yet. But that's what we're doing. You know, we have journals now. We have a journal called the Journal of the Prevention of Alzheimer's Disease. We have clinical trials on preventing Alzheimer's. We have clinics on preventing Alzheimer's. So when it comes to prevention, these have been very exciting times, and I would say over the next several years, especially 5 or 10 years, I would say that between 7 and 10 years from now, we're going to have something out there, aside from the lifestyle things and aside from the tests that we already order and aside from our current understanding. I think we're going to have some sort of drug that may help with Alzheimer's prevention. When it comes to a cure for Alzheimer's disease, this is tricky. Knowing now, and like we talked about, that Alzheimer's starts 20 to 30 years in the brain before the very first symptom of memory loss, finding a cure for Alzheimer's is very difficult because when you diagnose a person with Alzheimer's, they've had the disease for 20 to 30 years. It's much easier and much a clearer path to use a preventative strategy when someone hasn't had a disease for decades. When someone has already been diagnosed with Alzheimer's disease dementia, a cure is much more difficult. However, we are making progress. There are studies that are ongoing, and I can't tell you enough on how much we need volunteers for clinical research studies. And the more people that volunteer for studies, the quicker a cure and a preventative therapy will come. As one example, we have dozens and dozens, probably over 100 studies that are ongoing in Alzheimer's disease today. It takes, on average, 2 years for an Alzheimer's study to enroll. So say if a study needs to recruit 300 patients, and it takes 2 years for those 300 patients to volunteer. If all of those 300 patients were recruited on day 1, then the results of that clinical trial would be available 2 years earlier. So I can't underscore the importance of getting educated about clinical trials and potentially volunteering to participate. Okay, so this is the last question. What is the best resource for more information on Alzheimer's prevention? So what I would say is this is a really great start. Just the fact that all of you have taken the time out of your busy schedules, whether you're on a break from work or at home, or maybe for those of you watching this in a recorded session, whatever I can say is you've already made a really positive step in the right direction, and that's being willing to get educated and being open-minded that anyone today can start making brain healthier choices. Based on our research group, we actually have created a free online portable to answer all of these questions. It's completely free. It's available 24/7, 7 days a week. The website is called Alzheimer's Universe, and the website name is alzu.org. People can go online at any time and sign up. It's free, and basically we start with a brief survey, about a 10-minute survey, so we can learn more about you, and then it's a research study, so you can consent to donating your data to the research study, and then you can participate in lessons on your own time. You can watch it on your computer. The lessons tend to work a little bit better on the computer. They're also available on the tablet, and they also do work on the cell phones, but sometimes some people do have glitches. You can not only watch lessons, you can take them on your own pace. There's multiple lessons available, and you can also do a variety of activities. So the more lessons you complete, the more activities unlock. You can do brain activities and brain games. You can learn about how to see a doctor. You can track your nutrition through an online system that we developed. You can learn about how music activities can help, and as importantly, you can actually learn about Alzheimer's prevention registries that you can join right now online to receive more information. And for those people that are age 65 to 85, you can join that site and you can actually learn about a very specific Alzheimer's prevention study that's ongoing now. So again, that website is called Alzheimer's Universe, alzu.org, and we'd love to have you join. Actually, we do have some time for one more question. This is from M. Johnson. And the question is, please repeat the name of the scan or the test. Okay, I think you're referring to the very specific test that is more accurate or more sensitive or specific for Alzheimer's disease. It's a neuroimaging test or a brain x-ray. It's called a PET scan, P-E-T. PET, just you can say PET, but it stands for positron emission tomography. It's a long word, alphabet soup, PET, but it's not just a regular PET scan. This is why things get complicated. It's actually called an amyloid PET scan, AMYLOID, amyloid PET scan, and that can be ordered by by physicians. The problem with the amyloid PET scan is it's expensive. It's not routinely covered by insurance. It can cost over $5,000 to $6,000 for each scan. That being said, they're pretty accurate. There's 3 different ones in the market, and only your doctor can order this, and that's usually after a person has had all of these studies. If a person is normal and doesn't have memory loss, but wants to know if they have amyloid in their brain, another way to order this study is actually not pay the money, but actually be involved in a clinical research trial. And that's not just a great way to get a free study, but it's also a great way to potentially get randomized or put in a group that gets an experimental medication. This is just one of several options, but people that want to pay can pay also. Okay, with that, I think we're out of time. So I just want to thank all of you for tuning in. I hope you have enjoyed, and hope most importantly you've learned something, and hopefully you've taken something away and you can talk to your doctor, maybe make a brain healthy choice, and hopefully you can join Alzheimer's Universe at alzu.org and learn more there. Thank you so much.